Good morning. Come on in. You can have a seat right there. How are you today? Good. I'm doing well, thank you. Okay. The medication that we have you on has to be taken daily, and you've been doing that now for several months. Would you say it's still working without any side effects? Yes. Right. When we last spoke, you said that everything was going quite well for you. We looked at your diagnostics, your levels were good, and it does appear that you are responding extremely well to this medicine. So, as we also talked about, we do have an implant device that we can place into your arm, and this would deliver your medicine every day within a constant, very small range, so your effects will be reduced even further. Now, in your case, you're having, yes, either little to no effects day to day, so you won't notice this at all, and it's a much more consistent delivery of the medicine, and it can actually save you some money month to month. So this is an excellent option as long as we know that you're responding to this medicine and we've selected the right one for you. Okay, so you're still interested in getting that implant. Oh, great. I'd just like to make sure that I offer one last talk about it before we decide to put it in. However, this is extremely easy to implant as well as remove. So if for any reason we decide you aren't happy with this, I can remove it, and it's as simple as that. No, this won't leave a scar. In some cases, there is a very small scar. It's not very common, and it will fade, so it won't be anything that's visible. If you really feel around for it with your fingertips, you will be able to feel it, but it's extremely small. This is a tiny plastic rod that we'll be putting in. Yes, so that shouldn't be a concern. And you may also be wondering about stopping your current medication and switching to this. The condition that we're treating with this prescription will still be treated. As soon as I put this in, it becomes effective. So you can stop taking your current prescription because you will leave here today with this device and it will immediately begin treating you. So you shouldn't experience any flare-ups with your condition. You should still be fully medicated and it will keep it under control. Yes. Before we go any further with the implant process, I would just like to perform a very brief exam on a couple of things. You see here, the nurse has already gotten your blood pressure outside. That looks perfect. And are you feeling generally well today? You're not ill? Very good. If you'll just sit up straight, I'm going to place my hand right here and listen to your heart. Okay. You just breathe normally. Good. Okay. And around your back. Take a deep breath for me. Deep breath. Deep breath. And one more time. Okay, that's great. Your heart sounds good, your lungs sound good. And now if you'll just look straight ahead right here. Good. I'm going to look at your eyes. Straight ahead. And look up. Look down. Over to this side. And to your left. I'm just gonna peek below your lid. Okay, nice and pink. Your eyes look great. And open your mouth. Nice and wide. Okay. And lift up your tongue for me. Excellent. Alright. So everything looks perfectly normal. You seem to be in generally good health. I think we're just fine to proceed today. So if I can get you to just lay back. Good. And I'm going to extend this. Alright. Now just put your arm on this extension. Lay it flat with your palm up. Good. Okay. Now how this works is I have this sterile hollow insertion device, and it has the medical device inside of it to deliver your medicine. I'm going to numb the area, plenty of local anesthetic. After that, you really won't feel a thing, at which point I will insert the device, and because it's hollow, I will unlock it and remove it, which will leave your small plastic medical device in your arm. And that's all there is to it. Okay. And are you allergic to latex? No. I just make sure and ask so that I can select the appropriate gloves. Now the first thing I'm going to do is just cleanse the area, disinfect it. Yes, it is kind of like giving blood. It's great that you donate. I know a lot of people are quite squeamish about it, which is understandable, but it's really not that big of a deal. Okay. I'm going to apply a local anesthetic. Yes, very tiny. Okay. I'm just drawing up the solution. Okay. Tiny pinch. Good. One more tiny pinch. One more. Yes, you really can't even feel this. It's extremely small. Okay. And last one. Good. I'm going to clean up a little bit and give that a moment to set in. Just a slight poke. Can you feel this? This. 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 Great. device ready. And I'm just going to insert this. You will feel some pressure, but no pain. If I can get you good. Alright. 3, 2, 1. And okay. I'm going to unlock it and release the device. And removing this now, and that's it. Yep, it's in. Okay, and just sit tight. Don't move. I'm going to clean this up a little bit. And just palpate with my fingers to be sure that it's where I want it. No, this should not move around now that it's been inserted. If you notice it drifting, which it shouldn't, but if anything happens, just give me a call. But it seems to be right where I want it. Feels good. Okay. You can just relax and lay right there. I'm not quite done. I'm just going to place a bandage on here. No, you're really not even bleeding, which is great. There you go. Is that comfortable? You can't feel it. Yeah. Okay. That looks great. And how do you feel? Are you okay? No dizziness? I'm just going to take a quick feel of your pulse. Lie nice and still. And that feels perfectly normal. Okay. And when you feel ready, you can sit up very slowly. Good. Are you experiencing any lightheadedness? No. Wonderful. Okay, well everything looks really good. Now, I am going to have you come in 2 months. We're going to check your levels and make sure that this has stayed in place. And at that point, if it's where we like it, odds are it's settled and you're going to be good for the long term. And your visits will be much more infrequent. Yes. Okay. And if anything feels strange or out of place, give me a call immediately. This can be removed within seconds, so it's nothing to worry about. Yes, I think you'll be very happy with the device. I always recommend this. Well, that's excellent. Yeah, you're all done. So, if you feel ready, you can go ahead and go to the lobby. Okay. Well, excellent. I'll see you in 2 months. Thank you so much.